All right, welcome back to an episode of Healing at the Speed of Light.
Good morning.
Good morning. We're getting into beautiful spring weather here in Montana, which is, it is. It's always exciting. Mm-hmm. So, finally. So, we are going to be talking today about actually a series of studies about diabetic neuropathy, PRP injections, and laser therapy.
Wow.
Yes.
Heavy schedule today.
Yes, a little bit. And I promise not to overwhelm you with the scientific mumbo jumbo. But I have a few quotes that are really good that I think everybody can benefit from, because diabetic neuropathies in general, are a really challenging problem to try and solve. Mm-hmm. You know that. You've seen hundreds of people go through treatment for diabetic neuropathy.
Right.
So it can be a real drain on folks. And there's dangers with diabetic neuropathy. Wounds that don't heal, in the feet and causing amputation. Mm-hmm. There are the increased risk of falling and getting hurt because you can't feel where your feet are. Mm-hmm. Lack of sleep. So then you end up with brain fog and all kinds of other problems because you can't sleep because the pain hurts, too much.
Right.
So this is a big subject. Now, we've done a lot of episodes already on laser therapy and diabetic neuropathy, so this is going to be a little bit different. We're actually going back to a couple of studies we've covered before, and we're introducing this idea of PRP injections to try and stimulate healing in the nerves. So before I get too far into that, this is Christy, who's joined me today again, thankfully. Christy is a certified laser tech, and she's also the developer of our online training programs for doctors. So if you're a healthcare provider and you want to learn about how to use laser therapy for painful conditions like diabetic neuropathy, get a hold of us. You can see some of the amazing work that Christy and others have done as well.
It's a collaborative effort.
Yes,
so,
yes.
Yeah, it's not just me. It's taking what you know and getting it out there for people. So.
Well, it wouldn't be out there without you. So,
well, like I said, collaborative effort.
Yes, that's good. That's what we need.
So, yeah.
My name is Jason Roundtree. I'm a chiropractor and a certified medical laser safety officer, and I've been doing laser for over a decade. We've done, I don't think we're at 1 million treatments yet, but we got to be getting close.
Getting close.
Yeah.
Yeah. It's exciting and amazing to think about.
Yeah.
Yeah.
Yep. It's pretty cool.
So,
well, let's get right into this. So the idea with diabetic neuropathy is that the nerves become damaged to a point that they are not functional anymore. Mm-hmm. And that happens in diabetics because of the sustained high sugar levels. Mm-hmm. That's a toxic environment. Same thing can happen, though, with chemotherapy and other medications that can create a toxic environment, and then that damages the nerves. And then the problem is nerves don't heal very well. We know now they can. Mm-hmm. So if anybody's telling you that nerve damage is permanent, can never be changed, it's not really accurate. Mm-hmm. We can have some good improvement on nerve healing and nerve regeneration, but it's very, very slow. Mm-hmm. And especially if you're a diabetic, the body is kind of working against itself a little bit there, especially if you don't have your sugars controlled. There's just no way that the body can get the repair work done.
Right.
So then people go, okay, well, I need to feel better. I need to be able to get rid of some of this pain because it'll drive you up the wall. But, of course, if you introduce the idea of an alternative to just relieving pain, the alternative would be to repair the nerves or try to regenerate the nerves. Mm-hmm. Most healthcare providers were trained like me that we couldn't do that. We have more and more evidence that, in some cases at least, you can actually repair and regenerate nerves. And then that leads to increased nerve function. The nerves actually fire like they're supposed to. Mm-hmm. So then you have decreased pain.
Right.
That's the idea.
Right.
Whereas if you're looking at a pain relief model, where you're just focused on bringing pain levels down, you're going to rely on medications and supplements. Mm-hmm. There are some supplements that can be helpful. That's going to have an ongoing cost. And in the case of medications, at least, it's going to have ongoing side effects.
As I say, side effects.
Yes.
Yes.
And most people, I've talked to very few people who are totally fine with taking a medication for the rest of their lives. Most of us don't want to do that.
Not when,
if there's any other option.
Right.
Yeah.
And there's something to look into.
Yeah.
We do have options.
Yeah, there are options. So, just to bring out a quote from this particular study, and we'll drop links to these studies, probably even in the comments here after the end of this broadcast, and definitely in the show notes on the podcast notes there. But to bring out a quote to really talk about this and really add some depth to what neuropathy is and what it does, they say diabetic peripheral neuropathy is frequently the most common microvascular complication of both type 1 and 2 diabetes. It is thought to be progressive and irreversible. It is a consequence of peripheral nerve injury, and that is a response of a loss of the microvessels, very small vessels that feed the nerve, a loss of the axon, and axonal atrophy, shrinking of that axon. All nerve fibers may be injured, but small myelinated and unmyelinated fibers that conduct pain and temperature are the most affected. Not only does the nerve die, but the repairing mechanisms of nerve regeneration are also affected. In association with neuropathy, disturbed microcirculation is responsible for the development of diabetic gangrene, ulcers, and infections of the skin and bone. So, that's gross. That's
very
rough.
That doesn't sound very, very nice.
No, it's not, and we have more and more people that are affected by this every year. It's not just an aging thing; it's a lifestyle thing, and you know, age does play a part for sure. But certainly, an unhealthy lifestyle is really what leads to this road.
Right.
The tough thing is that once you decide to make a lifestyle change, it can be helpful. But it is so difficult for some people, especially if you already have pain and you get more pain with activity. How do you get to where you can exercise?
Right.
You can make the dietary changes, medication-based changes to try and improve sugar levels, but it can still be very much an uphill battle. So if we're talking about this type of damage, you know, we're affecting the small vessels, we're affecting the small, tiny nerve endings, the larger nerves as well. How do you actually talk about reversing that? Well, there's not many things that can. There are some things that can help with reducing pain, of course, like medications.
Right.
Even acupuncture has been shown to help with some of the pain levels in some cases. TENS and other like electric stimulation type therapies, those can help with pain reduction to some degree. None of those really stimulate a repair process in the nerves. So I already gave away the secret at the top here. We're going to be talking about restoring and regenerating nerves with both PRP and laser. So let me come back to PRP injections here in just a minute and give you a couple of quotes to refresh you on laser and how laser works for this particular condition, because laser is completely non-invasive. We're not talking about cutting or burning tissues.
Right.
We're using light to stimulate the biology of those tissues and try and stimulate that repair action.
Stimulate repair, yeah.
Yep. So to bring you a quote from this same study again, they say that and this was looking at laser therapy for diabetic neuropathy patients. They said the microvascular skin circulation increased by 35.8% in those who had laser therapy as opposed to those who did not, which is a huge increase in circulation.
Right.
And we know circulation is one of the major problems with neuropathy and ulcerations, gangrene, and all that. They say that this remarkable finding may suggest that upon treatment with laser, the skin of individuals with diabetes generates a response at the microvascular level, and that led to patients having a 26.4% decrease in pain over 4 weeks of laser treatment.
That's pretty incredible.
It is. It is.
Mean, that kind of decrease in pain just in a short period of time.
Oh, yeah. With no drugs, no side effects.
Right.
No discomfort.
Right.
A few sessions of laser therapy and your pain's down by a quarter. And that's not ongoing laser treatment either.
Right.
That's 4 weeks and done. They got over 25% of the pain relief. That's not actually any better. I'm sorry, that's not any worse than medications. It's about the same as what people get from medications, but then you have to stay on the medications.
Right.
And those have the side effects. And so you can get just as good with laser therapy, at least in a lot of cases. So a different study said that what laser therapy does is it presents important therapeutic results on remodeling scar tissue, since it is able to reduce inflammatory processes, reduce edema or swelling, promote analgesic effects or pain reduction, stimulate phagocytosis by macrophages. That sounded weird. Let me say that again. Stimulate phagocytosis by macrophages, which are the white blood cells that get in there and kind of chew up unhealthy tissue, and increase collagen synthesis by fibroblasts. Laser therapy can stimulate myofibroblastic differentiation in the early stages of healing by increasing mitotic velocity and tissue repair efficiency. It is believed that the mechanism of action consists of the absorption of photons, or little light packets, by the cell, which possibly accelerates the activity of the electron transport chain, increasing the synthesis of ATP in the mitochondria. All that just means it makes the cells produce energy faster and makes all their processes work better, so that you can overcome this damage issue and stimulate a repair process.
I'm glad you re-emphasized what that means, because that was a lot of words.
So that's as bad as it's going to get today too with those. The rest, everything else I got to say is pretty plain language. But yeah, I mean, we're just looking at and delivering light energy in a way that it helps the cell's energy levels.
Right.
That's it. That's as simple as the process gets. And if you can do that, it helps the body do what it's designed to do, which is repair.
And that's what we're after, with no side effects. Just
that's right.
The side effect is repair.
Yeah. Exactly. So we've covered that a good bit of time. So that might be old news to you if you've joined us before. Might be new news to you if you have not heard of this before. Certainly something I would encourage everyone with neuropathy to check out, investigate, do the research on yourself. Listen to some more of the podcasts that we've done on laser therapy. Find somebody in your area that has laser treatment and knows what they're doing with it in order to deliver good laser treatments. You can go to our website and find great laser therapy providers for neuropathy and neuropathic pain syndromes. You can go to lasertherapyinstitute.org and then click on the clinics tab. That's where you'll be able to find anybody that might be near you. And if you're having trouble finding somebody near you, you can get a hold of us directly too by emailing us info@lasertherapyinstitute.org. We'll do what we can to help you out.
Right.
But we also have another aspect here to talk about. Not just that laser is good, but also PRP injections.
Now, explain what PRP is.
Yes, right. It is a series of 3 letters, P and then an R. Sorry, I couldn't help myself. No,
yes.
PRP stands for platelet-rich plasma. So that is where you can take the patient's own blood and centrifuge it, spin it to separate out the different components, and then be able to draw out just the platelets and a little bit of plasma. Now, if you remember your high school biology and things like that, then platelets are what cause your blood to clot. Okay? Which is a problem if you've got clotting issues, right? But if you cut yourself, you need your blood to clot, right? You need that process to happen. But it turns out platelets have a whole other side of their function, is not just to clot when you have a bleed, but also to break open and stimulate the initial stages of the repair process, calling stem cells to the area, creating the collagen and fibrin that needs to fit into that area to seal it up and improve it. And so they have a massive repair effect.
So it just stimulates quicker repair?
It does, absolutely. Or stimulates repair in areas that normally you wouldn't be able to have repair. An example is that they've been doing this in tendon tears for a long time, right? Achilles tendon tears especially, and we do these often too. But if you can deliver these platelets to the inside of the tendon where the tear is, that area doesn't get blood flow, or very, very little.
Right.
So you're kind of forcing this concentrated dose of platelets in there, at which point they do exactly what they're supposed to do, which is stimulate a repair process, even in tissues that normally wouldn't be able to do that. So we're kind of shortcutting the whole thing and taking your body's own regenerative capacity and putting it where it needs to go, where we have damage. So if we could do that with tendons, these researchers said, why not nerves?
Why not?
Why not? Yep. So this is one of the only studies that's been done. So look, this is not proven science, not nearly as solid as the science we have on laser therapy, actually. But still, it's really exciting because we know PRP can work so well with pain relief. It can work extremely well with repair. And this is a really pretty great study from Egypt, some Egyptian researchers who said, we have so many people suffering with neuropathy. What if we had a way to help those people by using their own blood, their own platelets?
When was this study done? This
was actually published in 2019 by the American Academy of Pain Medicine. And the title of the study is Perineural Platelet-Rich Plasma for Diabetic Neuropathic Pain. Could it make a difference? And they looked at some older studies that had been done on animal models and said, hey, this looks like it would be, for one thing, safe to do for people, but potentially beneficial for pain levels and nerve regeneration. And so they took about 60 people, split them into two groups, and the first group of 30 people got traditional medical treatment. And that included some pretty good stuff. That included optimal glycemic control, or controlling your sugars, controlling the diet, right? Vitamin B complex, a critical nerve repair supplement. Alpha lipoic acid, which we know helps nerves and helps protect new nerve endings, especially prevents continued damage, as well as SSRIs and Lyrica. So that's a pretty standard care plan. I mean, really, that's what a lot of neurologists are probably going to recommend if you go to your neurologist with a neuropathy condition, diabetic neuropathy in particular. And I think the most critical piece of that to point out is that glycemic control. If you're constantly poisoning those nerves with increased sugar levels, nothing is going to make them better. You have to get that under control before you do anything. I mean, even medications are not going to work.
Right.
To control the pain, not well, if you don't control the sugar intake. Certainly, trying to do laser therapy without controlling the sugars, trying to do any other treatments, they're not likely to do well, at least not on the longer term.
Oh, and you keep poisoning yourself, as you said. I mean, it's not going to have any effect because you just keep reintroducing that poison, basically.
Yes. It's like if you came in and you said, hey, my face hurts because I opened doors with it. Well, we can definitely treat your facial pain, but if you go walk out the door and you do one of these again to open the door, I mean, there's only so much we can do there, right? And that's kind of a strong example maybe, but that's really what diabetics are doing if they're not controlling their sugars. They're opening that door with their face and going, oh, my face hurts. Well, yeah, it's going to keep getting worse, too, because you won't change what you're doing.
Changing what you're doing.
Open the door using the handle, not your face.
Yeah. Yeah.
That's a weird example, but hopefully it gets your attention. That's really what you're doing if you're a diabetic not controlling your sugars. And I don't mean to say that lightly. I know it's not easy. Trust me, my dietary stuff, I am horrible with trying to be self-controlled on what I eat, what I don't eat. I understand. It's just that important that you have that control before you try any treatments, any therapies, anything like that. You get that controlled. Take the supplements. Medications might be useful for you, but get the sugars under control. So anyway, 30 people, all those medications, supplements, everything, they did that over a 6-month time period. The other 30 people had PRP injections. So they also did have access to the medical care, same exact medical care. Okay. So supplements are good, right? Medications can be useful. They really can be. Definitely. And then optimal glycemic control. Control the sugars, control the diet. So they had these injections. They had the nerves actually injected above the ankle and above the wrist. So for both upper extremity and lower extremity neuropathy pain. Okay. And what they did, they took platelet-rich plasma, which I will describe a little bit more. Platelet-rich plasma, they say it induces cell signaling molecules release, for example, nerve growth factor, vascular endothelial growth factor, and fibronectin. These biomarkers are known to be involved in the modulation of stem cell-like myelinating Schwann cell activation, resolution of inflammation, angiogenesis, or production of new blood vessels, and fibrogenesis. Hence, the recovery of nerve function can be enhanced. Platelet-derived angiogenesis factors can stimulate new capillary growth through the enhanced migration of endothelial cells. Now, a lot of this sounds like what we read on laser therapy too, but a little bit different. Some different words, different terms, right? Just keep that in mind as we go on.
Okay.
So they had 30 people who got that. 30 people got these guided injections to different nerves along the kind of right above the ankle and then above the wrist. The idea is that you're putting that PRP right next to the nerve, the perineurium, which is the surrounding, the tissue that surrounds the nerves, not straight into the nerve. You don't want to do that necessarily. You don't want to put a needle into the nerve. It's not real pleasant.
No.
But what you do want to do is get that PRP solution around the nerve.
Because that's going to draw the healing and repair to that location.
Right. And the interesting thing is they weren't doing the very, very fine, tiny nerve endings down like in the fingers. You know, even though that's where the pain is, they were doing it up here. So they were stimulating the nerve kind of along the trunk. And then what they saw, it was actually pretty amazing. So this single session of injections was done. They saw ongoing improvement over the next 6 months, decreasing pain, decreasing numbness, and increased nerve function. They actually measured the way the nerves fire, and they saw improvements in the way those nerves function as compared to the group that was getting the same kind of medical care. Now, the group that got the medical care did have some level of improvement in pain, no improvement in numbness, and some improvement in function.
Okay.
But the PRP group had massive improvements in all those.
Oh,
Yes.
nice.
So numbness went down to almost nothing.
Wow. That's incredible.
It is.
That really is incredible.
Absolutely is. It's really exciting stuff. So the reason I wanted to bring up the laser first is that the laser has a different mechanism of action, specifically on the more superficial blood flow side. And then the injections of PRP can have a larger effect on the nerve trunk itself and the function, the repair function of the entire nerve, not just the nerve endings. So what happens when you pair this together?
Yeah.
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 It could be really, really good.
Exactly.
Because you're addressing so many different ways, so many different aspects of nerve repair, not just the more superficial nerve endings, but the deep nerve, the superficial nerve, the microvasculature. You're getting more actual nerve repair at the cellular level, but with this process.
Wow.
And then to see that it's ongoing after that too.
I was just going to say, it's not just temporary. It helps continued repair, not just for a time period. It's on. We know laser therapy is long lasting and continual. That's exciting.
It is exciting. Yes,
like,
it
wow.
is exciting. Yep. So certainly things to look into if you're suffering with diabetic neuropathy or you know someone who is, or other types of neuropathy potentially even. You know, again, this is the only study we have on PRP and neuropathy, but we don't have any negative studies either. Just this one saying, hey, great improvements with a single injection over a 6-month period. In association with controlling sugars. And then we know laser therapy can do amazing things. That one study, 26% reduction in pain in just 4 weeks, along with 35% improvement in the microcirculation. I mean, you pair these together, the results could be tremendous.
There's tremendous hope.
Yeah.
Tremendous hope. So, it's
Well, thank you.
exciting. Yeah. Look forward to continued research on this.
Yes, lots of research.
So-
And like I mentioned before, we'll go ahead and drop the links to these studies in the show notes or in the comments here on Facebook. Certainly come back and join us in a couple weeks when we do some more research review. If you have questions on any of this, though, you can definitely email us, info@lasertherapyinstitute.org.
Thank you.
Thank you.